Hey there, wonderful people of the internet. Welcome back to our cozy corner of knowledge and chit-chat. Today, we're diving deep into the fascinating world of phobias, those pesky little monsters that can turn an ordinary day into a roller coaster of fear and anxiety. But fear not, pun intended, because we'll also explore some effective ways to deal with these phobias and reclaim our peace of mind. So, grab your favorite drink, get comfy, and let's get started. First things first, what exactly is a phobia? Well, in simple terms, it's an intense and irrational fear of something specific. It could be a fear of heights, acrophobia, spiders, arachnophobia, crowded spaces, agoraphobia, or even clowns, coulrophobia. The list is as diverse as human imagination allows. These are the ones we just mentioned, fears of specific objects or situations. For example, fear of flying, aviophobia, or fear of needles, trypanophobia. They can stem from past experiences, learned behaviors, or even cultural influences. The key characteristic is that the fear is disproportionate to the actual danger posed by the object or situation. Social phobia or social anxiety disorder is more about fear of social situations or scrutiny by others. It's not just feeling nervous before a presentation, it's a paralyzing fear that can interfere with daily life. Think of it as the fear of being judged, criticized, or embarrassed in social settings. Agoraphobia often gets misunderstood. It's not just about being afraid of open spaces. It's a fear of situations where escape might be difficult or help unavailable if panic strikes. So, it can involve fear of crowds, public transportation, or even leaving home altogether. Panic attacks can be triggered by specific phobias or occur unexpectedly. These are intense episodes of fear or discomfort that peak within minutes, often accompanied by physical symptoms like rapid heartbeat, sweating, trembling, and a sense of impending doom. Generalized anxiety disorder is not a phobia, but worth mentioning. GAD is more about persistent and excessive worry about various aspects of life, like work, health, finances, or relationships. It can be a breeding ground for phobias if left unmanaged. Now, let's talk about what causes these phobias and what triggers them. It's like unraveling a mystery, except the clues are in our minds. There's evidence to suggest that some phobias have a genetic component. If your parents or close relatives have a specific phobia, you might be more prone to developing it yourself. Imbalances in brain chemicals like serotonin and dopamine can also play a role in anxiety disorders, including phobias. Sometimes, a phobia can stem from a traumatic experience linked to the feared object or situation. For instance, a dog bite in childhood could lead to a lifelong fear of dogs called cynophobia. We're great at learning, sometimes too great. If you witness someone reacting fearfully to something repeatedly, you might internalize that fear yourself, even if there's no logical reason for it. Believe it or not, cultural factors can contribute to phobias. Certain cultures may associate specific objects or situations with danger or taboo, leading to widespread fears within that community. Alright, enough about the why and how of phobias. Let's shift gears and talk about how we can tackle these fears head-on. Knowledge is power. Understanding your phobia is the first step to overcoming it. Educate yourself about what triggers your fear, how it affects you physically and emotionally, and what you can do to regain control. Gradual exposure is a fancy term for facing your fear in small, manageable doses. If you're afraid of spiders, start by looking at pictures, then watching videos, and eventually being in the same room with a spider. Safely, of course. Over time, your brain learns that the feared object or situation isn't as terrifying as it initially seemed. Cognitive behavioral therapy is the golden standard in therapy for anxiety disorders. CBT helps you identify and challenge negative thought patterns related to your phobia. It teaches you coping skills, relaxation techniques, and how to reframe your thinking from, "I can't handle this" to "I can manage this." Mindfulness and meditation aren't just buzzwords. They're powerful tools for calming an anxious mind. Learning to be present in the moment, focusing on your breath, and practicing self-compassion can work wonders in reducing phobia-related anxiety. Don't go it alone. Reach out to friends, family, or support groups who understand what you're going through. Sharing your fears and experiences can lighten the emotional load and provide valuable encouragement. Sometimes, phobias can be stubborn little critters. If self-help strategies aren't cutting it, don't hesitate to seek professional help. Therapists, counselors, and psychiatrists are trained to guide you through the maze of fears and empower you to reclaim your life. You know, I used to have a phobia of public speaking. Just the thought of standing in front of a crowd made my palms sweat and my heart race like a Formula One car. But with persistence, practice, and a sprinkle of self-compassion, I gradually turned that fear into a manageable challenge. Now, I can confidently chat away with all of you lovely folks without breaking a sweat. Well, maybe just a little. And there you have it. Folks, a crash course on phobias and how to show them who's boss. Remember, it's okay to be afraid, but it's even better to face those fears with courage and resilience. Until next time, stay curious, stay brave, and keep shining bright. Take care, my fellow adventurers.